and I think you're doing a great job as our Secretary, and I really appreciate it very much on behalf of our veterans. How will the 1,900 new VA mental health employees be allocated amongst facilities?
Let me call on Dr. Petzl.
Thank you, Mr. Secretary. Congressman Bilirakis, we have a tentative distribution to the networks. We are now discussing with the networks the actual distribution to each one of the facilities. And I had mentioned earlier in testimony that we hope to know the allocations to individual medical centers within about a couple of weeks.
Okay, thank you very much. I want to follow up on Mrs. Brown's testimony questions with regard to telemedicine. I've spoken to many in my district, both on the healthcare providers and veterans, and have learned that stigma and individual will are significant barriers for service members and veterans to seek out mental health services. Can you elaborate? You mentioned briefly, of course, on the telehealth services in your testimony, and you answered Ms. Brown's questions. The availability is very important, and how are they informed that such services are available to them, and can they gain the access? And in your opinion, will this reduce the stigma associated with mental health services? So that's important. And also, how effective are these services?
Dr. Petzl.
Congressman Bilirakis, you make an excellent point about stigma, and the VA is involved in a nationwide campaign to help reduce the stigma that's associated with seeking care for mental health. Two of the things that we're doing, I think, are significant. One is that we're providing mental health services now in the primary care clinics, so that a patient doesn't have to go into a special clinic that's got a sign, say, mental health on the top of the door, and be identified as somebody going into a mental health clinic. They get this care as a part of their primary care, which I think is very reassuring, if you will, to those patients. Number two,
do they choose these type of services?
We provide it. We offer
voluntarily to do the telemedicine as opposed to the face-to-face appointments.
There is some choice associated. I just want to mention telemedicine is the same way. It's done in the clinic, and it's not associated with walking into a particular mental health clinic. In some cases, there is a choice. When it's available, it's offered. I can tell you that. Most people pick up on it, but not everybody.
Thank you very much. Again, you know, we don't really want this to be utilized in lieu of face-to-face. But if we can have the telehealth appointments, I think that's very, very important that they get the care they need immediately rather than waiting. You want to comment on that?
I absolutely agree with you. I'll just give you my personal opinion is that in terms of mental health, 10 years from now, 40 or 50% of the encounters that you see in mental health are going to be done by a telemental health, I think. I don't mean just in this system, but I mean across the country. And I think when you talk about general consultations, here's what I think is going to happen. You're going to have a primary care doctor. He's going to see a patient, and he's going to say, you need a cardiology consult. They're going to dial up on their webcams, the cardiologist, and that consultation is going to begin right then, whether it's 200 miles away or 2 floors away. It is definitely the wave of the future.
Have the VA looked into partnering with private telemedicine mental health providers? You're doing that currently. I believe there's a pilot program, but do you plan to expand that?
Well, Congressman, I'm not aware that we have a pilot going or any interactions going with other mental health providers.
Maybe the Department of Defense?
With Defense, yes.
Okay.
And the PTSD telemental health program I mentioned with you before is actually with the University of Colorado, a non-VA provider. So there are some examples of that, and we would certainly encourage doing that where we can.
Okay, very good. Thank you very much. I yield back, Mr. Chairman.